In the airway and breathing course, we're in the airway prep unit. We've talked about prepping yourself, prepping your team, prepping your patient, prepping your equipment. This one's about prepping your patient. It's real quick, real easy. We need the patient's airway in the optimal position for maintaining an open airway, and that is, without a doubt, the true sniffing position, where we call it ear to sternal notch, where you take their external auditory meatus, their ear hole, and you make a line, imaginary line, from their ear hole to their sternal notch. And that line should be parallel to the ceiling. Their head should be placed in a position which will almost always require, in the adult at least, pillows, blankets, towels, something, maybe a module out of your first-in EMS pack, something to do some ramping here and get this patient's head in the proper position. This is one of the things that we're just not seeing in a lot of field environments. People are not taking the time to put the patient in the optimal position. Remember, your goal with airway management is to get in and get out. First pass success, first pass intubation. And if you can't intubate, you want to be able to oxygenate and ventilate. And patients oxygenate and ventilate best in this position. So that's the first part of prepping your patient. The second thing is real simple. Max out the O2. Crank it up all the way. Our tanks here in our system go up to 25 liters. Fine. Whatever your max is, max it out. Once you've gotten the intubation and the airway management is more or less over, you can back it back down to 15 liters so you don't run out of O2 in your tank and cause you some logistical problems. But crank it up, and at this point, we're not doing any kind of real cool pre-oxygenation, which we might do someday, maybe, hopefully. We end up with a second O2 tank with a nasal cannula in their nose at 15 liters, in addition to the O2 going to the bag valve mask. So we're delivering absolute maximum oxygen flow during this pre-oxygenation period. Pre-oxygenation period happens while you're prepping yourself, prepping your team, and prepping your equipment. So prep your patient's got two parts to it. Get them in the right position, max out their O2. It's as simple as that.